Welcome back everyone, and today we are getting into the shoulder joint. So what I'm going to be doing here is going over the basics of this shoulder joint in terms of what the anatomical structures are, the movements they have, and then a couple of different special things that the shoulder does that we don't see in too many other places in the body. So let's jump right into it. First thing here with the anatomy, you have four main joints that we're going to be looking at with the shoulder. You have your sternoclavicular joint, or the joint that's made up from the sternum and your clavicle. You have your acromioclavicular joint, which is made up of your acromion process and your clavicle. Your glenohumeral joint, that's the actual shoulder itself. So that is the joint between the head of the humerus and your scapula. And then your scapulothoracic articulation or scapulothoracic joint, that's where your scapula or your shoulder blade sits on the back of your rib cage. Our main bones that we're going to be dealing with here are going to be the humerus, the scapula, the clavicle, and the sternum. If I had to pick the major ones, it's going to be really the humerus, the scapula, and the clavicle. So our sternoclavicular joint, again, that's the joint that's formed between your sternum and your clavicle. That's really the least used that we're going to be talking about here. It's very stable. It doesn't have a whole lot of movement, so we're not going to be really bothering with that too much. The acromioclavicular joint also doesn't have a whole lot of movement along with it, and acts more of a really soft tissue stabilizer for the shoulder girdle as a whole. Now, the glenohumeral joint, this is where we get into our major movement here. So our glenohumeral joint, or the shoulder itself, is kind of like sitting a golf ball on a tee. The head of the humerus is way too big for the glenoid fossa we have here. So the glenoid fossa is very, very small. The head of the humerus fits this whole bit here. So there really isn't any bony stability going on with the shoulder. Everything you have to keep the shoulder stable is all soft tissue. So you have a big capsule that goes along with it. This allows you to have a lot of movement with the shoulder, but it makes it inherently unstable. And this just gives you a visual of what our shoulder capsule looks like. So again, main bones, humerus, especially the proximal end of the humerus is going to be most important for us there. The scapula. Now for the scapula, we have both here. This is the posterior and anterior view, and then we also have a lateral view for you there. On the posterior side, you should remember the inferior angle, which is the bottom here, the spine of the scapula, and then your superior border here. For the anterior side, you want to remember the glenoid cavity. Inside of that is the glenoid fossa. You have the acromion process and the coracoid process there. And then you're going to have here your medial and lateral borders. Now, getting into the muscles here, there's roughly 8 muscle groups we're going to be talking about that are going to play a role here for us with the shoulder. That's going to be our serratus anterior, our trapezius, our pec major, deltoids, our lats or latissimus dorsi, rhomboids, levator scapula or levator scapulae, however you pronounce that, and then your sits muscles or your rotator cuff muscles. So let's jump right into them here. So first off, pec major. That's going to be obviously your big chest muscle there. What this is going to do is it's going to help with shoulder flexion, horizontal adduction, and it's also going to help with internal rotation of the shoulder there. The deltoid has 3 segments. You have an anterior deltoid, your middle deltoid, and your posterior deltoid. They each move the arm in the direction they're facing. So your anterior deltoid is going to help with shoulder flexion. Your middle deltoid is going to help with shoulder abduction, and your posterior deltoid is going to be doing shoulder extension. Teres major, we're not too worried about here, but your lats or latissimus dorsi, that is going to be the widest muscle we have in our back. Primarily, what this is going to do is it's going to assist with medial rotation of the humerus, but primarily it's going to extend your shoulder and also is going to adduct your shoulder. When we get into our sits muscles or our rotator cuff muscles, these are four small muscles that go all around your humerus to act as really a protective barrier for your shoulder joint as a whole. Functionally, what these act as are decelerator muscles. So they're very small muscles, and they're going to help keep that shoulder in its socket. So SITS is an acronym for supraspinatus, infraspinatus, teres minor, and subscapularis. Supraspinatus is going to be this one here. You can see it from our either superior view or the lateral view, but this is going to assist with shoulder abduction. We have infraspinatus and teres minor, which are on the posterior side of the shoulder, and they wrap around into the side of it. These are going to help assist with external rotation. And then on the front here is subscapularis. So this takes up the entire anterior side of the scapula, and it attaches or inserts onto the anterior side of your humerus. This is going to assist with internal rotation. Your scapula moves in a number of different ways. Primarily, your scapula can move up, down, left, right, and then it can rotate up and down, or tilt up and down. When you abduct the scapula, you move it away from the spine. When you adduct, you bring it back towards the spine. When you elevate it, you go up. You depress, you go down. Upward rotation takes that inferior angle of the scapula that we talked about back here, and it rotates it upward. So you're going up with that. And then downward rotation takes that inferior angle and rotates it back downward. So the way you actually do that is to abduct. What you're going to be doing is you're going to be either pushing out or reaching across. That is going to make that scapula go out or go away from your spine. Adduction are any of your pulling motions. You squeeze your shoulder blades together, that is going to adduct the scapula. Elevation is a shrug. Depression is bringing the shoulders back down. Upward rotation is going to pair with shoulder abduction, and then downward rotation is going to pair with shoulder adduction. Now, our serratus anterior is going to play a big role with this. So serratus anterior, it shouldn't say the origin's on all the ribs. The origin's actually on the first 9 ribs, and it's going to insert on the medial border of the scapula. So it actually comes from all the way here to the inside of your scapula. And what this will do is it's going to help with letting your, kind of raising your arm up a bit. So it helps a little bit with elevating the shoulder, but primarily what it's going to be doing is going to be the scapular motion. So it helps with the protraction or the abduction of the scapula, and then it's going to help with upward rotation and downward rotation of the scapula. Our rhomboids primarily are going to be responsible for adduction of the scapula. So these are going to originate on really the bottom of your cervical spine and through T5. So they're going to be to your mid-thoracic spine, and they're going to insert all on the medial border of your scapula. This is going to be activated from pulling motions or squeezing the shoulder blades together. Levator scapula, that is a muscle that is going to originate in your neck. It actually originates at the base of your occipital bone, and then it attaches to the medial superior angle of the scapula. So this helps with elevating the scapula. So if you shrug, it's going to help there. Now your traps are the kind of granddaddy of your scapula. You cannot move your scapula without using your traps. So if you don't use your traps, you don't move your scapula. The traps are split into 3 sections as well. You have your upper traps, your middle traps, your lower traps. Upper traps are going to be the ones that primarily do the shoulder shrug. Your middle traps or your middle fibers primarily are going to be assisting the pulling motion or going inward, adducting your scapula. Your lower fibers or your lower trap muscles are going to assist primarily with depression of the scapula. Now the last two things here are with some special movements we have with the shoulder. The first one is this thing called scapulohumeral rhythm. What this says is that it takes the humerus and the scapula moving together to give you full abduction. So to abduct my arm completely or raise it completely overhead, what I have to do is I need to get a synergy between the scapula and the head of the humerus to give me enough clearance to do that. By itself, the humerus can only abduct you to about 120 degrees. And by itself, the scapula can only upward tilt about 60 degrees. You add both those together, you get full 180 degrees of shoulder abduction. If I were to keep my scapula fixed, my acromion process, or the bump that you feel on the top of your shoulder here, would stop or prevent my arm from going into abduction past that 120 degrees. It's only because my scapula rotates upward that it allows additional clearance to take place so that I get that full 180 degrees. So it moves in a 2-to-1 ratio. For every 2 degrees of humeral abduction, I get 1 degree of scapula upper tilt. And the last thing here is force couples. What force coupling is when you have a multi-directional movement that gives you one essentially circular motion. You would see this in, say, like your tires. So if I were, say, using my car and I had my tire here, my tires move forward, down, back, and up, but they all produce a forward motion. The same thing happens with the shoulder blade. So with my shoulder blade, what's going to happen is that I get movement from, say, the trapezius and the levator scapula, my serratus anterior, and my traps. Those all are going to pull in different directions, but they all pull in a direction that ends up with my scapula tilting upward. So I have one pulling this way, I have another pulling that way, and I have another going that way. All three of those act together to give me that upward rotation. Same thing happens with downward rotation. I get the rhomboids to retract or adduct the scapula. The levator scapula is going to elevate it, so I have it going inward and upward now, and then pec minor can help with pulling it really out and down, so giving me that downward tilt. So now all together that adds into that downward rotation of the scapula. So pretty much all that's just happening here is I have 3 different movements that all add up to one circular motion. And this just gives you a couple more examples about how this happens with the shoulder. So with here, you're seeing the deltoid pull up. So when I go into abduction, my deltoid pulls up, my supraspinatus pulls inward, and then subscapularis teres minor are going to help pull down to give that scapula time to rotate outward. All produces a movement or an osteokinematic movement of shoulder abduction. So that is everything with shoulder movements. Here, we're going to come back with the elbow, and then we'll be moving on from there. So until next time, I will see you all later.